Hi, Dr. Dave here with Synergy Wellness in New York City. We have a patient here, and we've actually done a video on his condition before, and probably many of you haven't seen. So if you haven't seen it, be sure to check that out. It's another video on a hemilaminectomy. So that's a back surgery for those of you that don't know, and for some of you watching this video, you do know, you're fully aware of hemilaminectomy. So here's our spine, right? And this is looking from the top of the vertebra. And if you look here and you zoom in a little, you'll see here is the lamina. And then the lamina come together and form the spinous, which is that little bone that sticks out here in the back of our neck and our lower back, right? Those little bones. If we sit down, it'll rub up against the seat, like on a hard seat, like a bus, right? Those are your spinous processes. And then the lamina come together to form your spinous. So what he had done was they came in and they cut out this part of the bone over here, one of the laminas. You have two, right? So they take one out based on where the herniation is to take pressure off of the nerve. Now it makes the back unstable, and a lot of times after 5 years, the surgery is ineffective. Post-surgical pain, and it's common for most surgeries. I would say the least invasive surgery would be a discectomy. If you can get away with just doing a discectomy, great, but we save people from having to have a discectomy or a hemilaminectomy in the first place. But he's had the surgery, he's had this side of the lamina removed, and the other side is there and intact. Some people have both, and that creates even more instability and very difficult to have long-lasting relief from surgery. So how long ago did you have your surgery?
10 years.
So he had it 10 years ago, and we see him once a month, and you've been doing pretty well, wouldn't you say? Once a month, it's been about a year now?
Yeah, no, it's gotten a lot better, for sure.
Yeah, so we see him once a month for checkups, and and he's okay. He's sore when he comes in once a month. But once you have surgery, it's it changes things internally there in the spine. So not only is the spine more unstable, but you're much more prone to aggravating your back. So we see him once a month, and we can limit or mitigate those risks, him aggravating his back. So what I'm doing right now is cold laser therapy, and we had done several cold laser therapies in the beginning when he came to me a year ago in acute pain. We did, I think, laser a couple times a week, right?
I rented it for a few weeks.
Yeah, you rented it for a week. And it took us about 4 to 6 weeks to get you to...
Yes, about 5, 6.
Yeah, and he was in really rough shape. And so since then, we took him off the 2-3 times a week care plan, and we've had him on once a month for a year now. And that's probably ideal for him. If he hadn't had surgery, I might say, well, in another couple months, we could change it to once every other month, right? But because he's had surgery and there's just more, he's more susceptible to instability and to re-aggravating it, once a month is the safest bet for him. So this laser, actually, I can scan the back and check for inflammation and soft tissue damage, and it beeps to let me know, and then it tells me how long to treat the area. You notice how it beeped higher up his back. His surgery was way down here. The reason for that is muscle guarding. I don't know if you've heard that term, but muscle guarding is when the adjacent muscles next to the injured area tighten up. And it's because your muscles around the injured area tend to guard themselves, right? So that's where the term muscle guarding comes from. All the muscles near the injury and adjacent to it tend to really tighten up, and it does that to try to prevent you from moving too much in a way that's going to aggravate your back. So it's a protective mechanism, but if you're muscle guarding for a long time, that can create more problems and make you more susceptible to re-aggravating it, because everything is so tight and preventing you from moving past a certain range of motion where your back would hurt. Okay, so right now it beeped right over his scar where he had the surgery, right over the hemilaminectomy.
I definitely felt a little release.
You did?
Yeah, I went down my leg.
Okay. So he just said, for those of you that couldn't hear, that he felt a release. This laser is powerful. It really is. And you couple cold laser therapy with Cox flexion distraction technique, which is the technique we've been using on him for the past year. And it's just it's a win-win. It really is. The hands down the best two therapies for any kind of post-surgical back or disc herniation or disc bulge or spinal stenosis. This is hands down the best combination of techniques. And you would want to do this before you go and get injections, nerve blocks, things like that, more invasive procedures. This is really non-invasive. The laser, obviously, as you can see in the flexion distraction technique you'll see in a minute, very non-invasive and gentle and effective, most importantly. So you see here it's dosing you here for a while, right? I've had it on this spot for, I don't know, as long as I've been running my mouth here for a minute. So,
Damage down there.
yeah. So it'll beep again. There you go. It beeps again when it's done treating. And sometimes I'll run back over the area just to make sure. And this is where we had some inflammation before, and obviously it still needs a little bit more dosing. So it's good to scan over the muscle a couple times is usually what I do. I like to be thorough. And hopefully our battery doesn't die out here, Tim.
Feels better already.
Good. Yeah, and we haven't even done the chiropractic technique. So this combination is hands down the best. If you're suffering from sciatica, just nothing helps, or you've done chiropractic and nothing helps, what technique have you done with your chiropractor? In other words, did he put you on your side, bend your top leg, your knee, and push, you hear a crack, or, while you're on your side? If so, that is not the best technique for a disc herniation, a disc bulge, or spinal stenosis, or even spondylolisthesis, or especially post-surgical backs. So if you've been to a chiropractor and you say that it didn't help you, two questions I have for you is, what technique did he use on you? And how often did you see him, and for how long? Did you at least give it 4 to 5 weeks, right? You need to do that at least. But more importantly, the technique, right? And Cox flexion distraction technique, hands down the best technique. Now, there are a lot of chiropractors with the table, but they're not certified. So just be careful of that. So that's it, folks. Hope you guys got something from this. And if you had back surgery, I hope you can get the right help. Thanks for tuning in. Thanks for smashing that thumbs up button. And of course, subscribe. 4 new videos every week. Thank you.